So I'm guessing the Windrush generation and many in the age group that I guess would be in their 70s, 80s,
Yeah,
some of them even in their 90s.
very
Now,
much so. Yeah,
when they're trying to get care from the system, when they're trying to get help from the system,
yeah,
there's difficulties because they came over in their younger days to help with in the NHS, and like you said, public services, and now they're elderly,
yeah.
they now can't get the support they need. So it's a massive problem, and so you're lobbying for them. And what else is the government doing for them so that they don't they some of these inequalities are alleviated in their old age? Yeah.
You see, it's an interesting one. You don't know what you don't know.
Mm,
And I think the generations that we come from were from a generation, they were very, very resilient. And
very.
they tried to do for themselves, and they didn't ask for handouts. They didn't expect anything as a right. So they continued to make ends meet with whatever they had. Um, Now we are, and there are two, let me say there are two sides to this. If you're talking about the people who can't prove their right to be here but need help and can't get it,
Yeah.
yes, that is very, very unfortunate. And there needs to be support for those people, because you get to the stage where you need support. There are assessments that are done as to
Yeah.
whether they meet the criteria for support, and I'm talking
Mhm.
about free support. And if they do not have recourse to public funds, then it would be like being in America and not having
Yeah.
health insurance.
Yeah.
And it may be that you may not be entitled to treatment, or if you are, you may have to go on a waiting list as opposed to get it straight away. Do you get what
Mm,
I mean?
yes.
But here we have an NHS system that was built by the majority of the Windrush generation.
The
Um,
irony.
and and the expectation would be that that same system would look after those people. Um, People can go to any kind of A&E and expect to get help. I think in this country, to be fair, as much as we want to knock the UK, it's probably one of the main countries that I
Mhm.
know that you could go to, walk into A&E and get support
Yeah.
without
Yeah.
too much. It's almost
Yeah.
as if we'll
Yeah.
support you, we'll give you the
Yeah.
help, and then we'll maybe ask the
Of
questions
questions
later. So
later.
from
Mm.
that perspective, if you call an ambulance, they're going to see to you. They're not going to. So I suppose from that perspective, we are pretty fortunate. Whereas there are other countries whereby they won't even touch you.
Yeah. Yeah.
So from that perspective, but you can't get away from the fact that there are health inequalities. Our elderly, yes, there is a means test. Yes, if you can't afford health, you will get it. You will get the health support.
Mhm.
But if you have to go into a home, it needs to be paid for.
Yeah.
So, you will have to have an assessment of, your means and your ability to pay. And if
Yeah.
you can't pay, then social care will cover that cost.
Mm.
Um, if you don't have the right to be here, however, that is a different
Yeah.
situation, you
Yeah.
know, and it doesn't mean that the country won't support you, because, there is a duty of care
Mm.
that we have, and there are acts that say if someone's suffering from mental health and other things, then you do need to help them.
Yeah.
So, but nevertheless, still there are inequalities, and a lot of it, let me say, a lot of it is because we don't know what we're entitled to, because
Yes.
we don't know how to seek the support, we
Mm.
don't.
Yeah.
So therefore, the effects are far-reaching for
Mm.
the minority groups than they are for those who were born here, raised here, and know what their entitlement. Because there are
Yes.
some that feel that they also have an entitlement,
Yes.
and
Yes.
and a lot of the Windrush generation don't feel that they have an entitlement, even though they
Mm.
came and they served. They don't
Yeah.
feel that there is an entitlement.